Ta-da! Hello everyone, welcome back to the YouTube channel, welcome back to another episode. Today we're going to be doing the first of the health series videos. I'm very excited about this because, as I've mentioned multiple times, I want this to be a hub of well-being on this channel. This video, the first video, is going to be all about so-called winter depression, otherwise known, or AKA, does AKA work as a reason? Ben's nodding at me. AKA seasonal affective disorder, SADS. It's something that's very, very common, affects a huge number of people around the UK, but many people aren't diagnosed and don't even know they have it. Let's start with the obvious. What is seasonal affective disorder? It's actually something that I experienced myself, along with I think many of you watching this video. It is depression symptoms that are related to the changing seasons. So what we're talking about is going from the summer, the autumnal and winter times, essentially feeling really down, low energy, lack of interest in things. When you get up in the morning, you think, oh, I don't want to get out of bed. I just feel a bit flat, to be honest. And sometimes these symptoms, you think, well, that's very odd. I don't know why I'm experiencing it now. And people build up this pattern and go, well, actually, it seems to happen in the winter, but not the summertime. Why is that? Should we talk about the causes? Now, there's lots of theories as to why this happens. We don't exactly 100% know for sure, but the theory relates around circadian rhythm, melatonin levels, and serotonin. So an area of the brain called the hypothalamus is very important for controlling melatonin. Melatonin is a hormone that impacts on our sleep. Circadian rhythm literally kind of means our sleep cycle, basically. So, when it's time to go to sleep, feeling tired, and when it's time to wake up, being awake. In the summertime, that strong morning sunlight is great for setting a point in your circadian rhythm, being this is morning time. And when the evening comes, your brain, your body knows it's time to sleep. Melatonin fits into this cycle and helps control that pattern. In the winter, melatonin levels tend to be higher with those with seasonal affective disorder. Serotonin is very important because it's a mood hormone. In fact, those with depression can have and often have reduced levels of serotonin. It's exactly why one of the main forms of treatments in terms of medication for depression is SSRIs, so selective serotonin reuptake inhibitors, which boost levels of serotonin in the brain. In those with seasonal affective disorder, serotonin levels are often lower. So serotonin levels lower, melatonin levels often higher, making you feel sleepy and tired, and a circadian rhythm can be really affected. These are the main causes we believe that contribute to seasonal affective disorder. What are the risk factors? What are the things that might contribute to having it or not having it? An obvious one maybe, being close to the equator is quite helpful. The further away you are from the equator, the more likely it is. We particularly get affected by the changes in the season. UK is a pretty good example. It's coming up to autumn now. Definitely getting colder. Some of the other risk factors include having depression already, so making it more likely. Being female is actually a risk factor, and also bipolar disorder. So how do you know if you've got it? Well, there are three big things that you can think about. Number one is having depressive symptoms relating to the winter seasons. That's a really, really big one. We know that 2 consecutive years or more of having seasonal change is a really strong indicator of having SADS. And the third point as well is having more frequent depressive episodes in the winter than other times of year. So essentially linking to that fact that we know that during those winter months and autumn months that this is happening. Essentially, go to your GP if you've got any doubts or questions or thoughts that you might have it, and the GP will talk you through the process. Now for some stats and facts. Affects 0.5 to 3% of the general population. Affects 10 to 20% of depressive disorder patients. Affects 25% of patients with bipolar disorder. Up to around 70% of patients with SAD have one or more relatives with the condition. 3 in every 100 people in the UK currently experience SAD, and I actually think that figure underrepresents the true number, because actually, how many people walk around that don't get diagnosed and actually experience this condition? Now let's talk about treatments. The good news is there's plenty we can do about it, but recognising and getting diagnosed and getting the help you need is an important first step. Otherwise, you go many winters without help. So let's talk about how to treat it. Number one, light therapy. There are special lamps that basically emit a light, a frequency of light that tells the body this is daytime, and it creates that circadian rhythm for you. It kind of sets the body clock, because we know that during the winter, particularly in the UK, we don't have that clear distinction where the light is basically strong enough to create that rhythm, and also the shorter days confuses the body. So these lamps help to reset that circadian rhythm and almost mimic what you experience in the summertime. As I mentioned earlier, serotonin levels can be significantly lower in patients with SAD, and that's why We use SSRIs, selective serotonin reuptake inhibitors. I nearly got there. We use those medications in some patients with SADS to help boost the level of serotonin, so lifting your mood, giving yourself that mental energy again. Now let's talk about vitamin D. Vitamin D is vital for our body. It plays a role in our immune system, the absorption of calcium, so maintaining strong bones, our mental health. Its deficiency is linked to cardiac problems, dementia, some cancers, and so on. So it's pretty important for our body. How do we get vitamin D? We can get vitamin D from some dietary sources, but most of it is absorbed through light, UV light. In the summer, great, a couple of hours a day we can get vitamin D and we maintain our levels. But in the winter, in the UK, even if you're outside for a good couple of hours, unfortunately, the strength of the UV basically isn't enough to absorb the amount that we need. And therefore, most adults should be taking vitamin D supplements from the end of summer, so entering autumn, all the way through to spring. Now you should always check before taking it, because some people with kidney problems in particular and a few other conditions shouldn't take vitamin D, so do check with your doctor. However, for most adults, it will be recommended, essentially for the reasons that we mentioned. Really helpful for preventing things like SADS, helps with your mood in general, of course, immune system and bones. And a reminder as well, you can get vitamin D over the counter from any shop pretty much, like any of the high street shops or any pharmacy, so check it out. And finally, psychotherapy. Talking therapies can be really helpful, because if you're experiencing SADS, like other forms of depression and anxiety, it can affect the way that we think and the way that we feel. And therefore, CBT and other talking therapies can be helpful too. Everyone's experience of health is different, but I hope this video has been helpful at identifying some things that you can do to help prevent SADS, and also what to do if you think you've got it and what treatments are available and out there. I hope you've enjoyed the video, guys. I've enjoyed making it. As I say, the first proper health video that I've made in a while, the first in this new series of wellbeing videos. And also a little bit of a reminder, I did a vitamin D video previously on my channel, so if you want to find out more about vitamin D and learn about its importance, there's a specific video on that. Please do jump in the comments, let me know about what you think about this video, the format, how we've made it, was it helpful, what are the topics you'd like to learn about. I'm also going to give you a little shout out, or give me a little shout out, my book, Live Well Every Day. I've written this as a 7-step guide to health, pretty much. So all the bits and pieces you need to know, sleep, exercise, nutrition, I mentioned vitamin D, of course, in this book as well. So check it out, you can get it from all good bookstores and online, of course. Thanks everyone for watching the video. I really enjoyed making this one. I hope you found it useful. Take care and goodbye.